I think we can hop right into it. Hopefully a couple more of the panelists show up later down the road and we can introduce them when they come. But for now, we can just go ahead and get started. Hi everyone, I'm Spencer. I'm the host for this room, and as we get started, just a few Clubhouse pointers for everyone. You can use the share button at the bottom of the room to share on social media or directly with others. If you're inviting people that you think might be interested in the conversation, you can use words like sickle cell or health equity to narrow your search. Find people that are following you that might be interested. Definitely would encourage everyone to share with people who they think might be interested in the conversation. In addition to sharing with individuals, we also highly encourage everyone to use Clubhouse's Share on Clubhouse feature. It'll just greatly increase the likelihood that people who are just browsing for rooms can find this room, and it'll just generally encourage traffic to our room and hopefully grow this audience. We also encourage everyone to follow all the panelists and all the audience members in the room here today. We're really trying to do our best to grow this community and get people involved that want to be informed about this space. Also, for people in the audience, we encourage everyone to raise their hand, ask questions. We can bring people up to the stage if you're interested in being a panelist as well. For those that don't yet know Consuli, broadly, Consuli is a public benefit company with the mission to enable individuals to participate in the data economy. Experts suggest our individual data is worth around $20K per year. We do this by operating a marketplace for members where we become their agent and assemble patients' health records, labs, prescriptions, wearables, quality of life surveys, etc. Importantly, members receive smart match individualized offers from us for opportunities, including to participate in clinical trials and data trials. There's no cost to join our movement. You can learn more at consuli.net. I'm also going to be putting up a link for a really important research study. Basically, if you have sickle cell or you know someone that has sickle cell and you might be interested in doing research and getting compensated for it, feel free to take this survey and we'll reach out as these opportunities come up. We're teaming up with places like Pfizer and Sanguine Biosciences. So definitely be sure to look at that survey and share it around as you see fit. As I introduce our panelists and guests, I'd like them to share what they perceive the core needs of the sickle cell community are at this time. So starting first is going to be Shakira Wesley. Shakira is a graduate of Clark Atlanta University and the founder of We Eat for Life. As a mother of two beautiful sickle cell warriors, it was their diagnosis that led her to create this organization. The mission of We Eat for Life is to bring awareness on the powers of eating healthy and how it can positively impact people living with sickle cell disease. I'm turning the mic to Shakira for her opening remarks, including touching on the core needs of the sickle cell community at this moment in history. This is Spencer, and I'm done speaking for now.
Hi, thanks so much for having me. So my organization, We Eat for Life, is mainly focused on building awareness on the positive effects of eating healthy. And so I do think that that is a core need that sickle cell patients have. But as far as health equity is concerned, I would definitely say funding, so that we can get more medication that is actually made for sickle cell patients. I'm sorry, my children are here with me, so you might hear them in the background. They're my two warriors. So apologies for that. But I definitely feel like one of the medications that sickle cell has had for years and years and years was not something that was necessarily made and created for sickle cell patients. Hydroxyurea was just so happened to find out that, oh, okay, we can also use this. But now we're seeing medications like Oxbryta and other things coming along that are made specifically for sickle cell patients. And so I think that if we're going to talk about health equity, we need to be talking about funding and making sure that people with sickle cell have medications that are specifically made for the issues and complications that we we face every day. So for me, I think those would be the biggest things.
Yeah, definitely. Would love to allocate a portion to our talk later today to talk about funding. It's a super important topic, and hopefully we'll have time to speak on it. Next up, I'd like to introduce Gregory Kato. Dr. Kato is a hematologist with particular expertise in sickle cell disease and co-editor of the latest textbook in sickle cell. He is leveraging his experience, passion, and network to find new ways to treat disease at plasma protein industry leader CSL Behring. He has nearly 30 years experience in patient care, consultative hematology, molecular biology lab, and clinical trial research at Johns Hopkins, NIH, and the University of Pittsburgh. Turning the mic to Dr. Kato now for opening remarks, including touching on the core needs of the sickle cell community. This is Spencer, and I'm done speaking for now.
I don't see him in the room.
I see him. He's the one with the little party hat, so I think this might be a first time on Clubhouse. There's a little microphone button in the bottom right.
Yeah, thank you, Spencer. You're absolutely right. I'm having trouble locating it. I'm also, unfortunately, in a bad cell phone signal area. Do you mind coming back to me in a moment? I'm going to check. I'm going to connect to the Wi-Fi so I can have a better signal.
Yeah, absolutely. Just to know, you're coming in loud and clear on my side, but yeah, happy to come back to you later down the line. In that case, I'll turn it over to Gina Glass. Gina is the founder and ex-director of Dream Sickle Kids Foundation, mother of a young sickle cell patient, sickle cell children's book author, award-winning sickle cell advocate working to make sickle cell popular by creating programs and initiatives that increase sickle cell awareness and address the health disparities experienced by the sickle cell community. Turning the mic to Gina for opening remarks, including touching on the core needs of the sickle cell community at this moment. This is Spencer, and I'm done speaking for now. Gina, are you able to take yourself off mute?
Oh, there it goes. I was looking for how to take it off of mute. Sorry there. Hi everybody. I'm Gina Glass here in Nevada. Founder and executive director of Dream Sickle Kids Foundation. I have a 7-year-old warrior with sickle cell type SS. So some of the issues, the equity issues and disparities with sickle cell that I think are really important to address would be our lack of qualified physicians that are able to treat patients with sickle cell disease. That the provider number gets even more limited once patients with sickle cell disease reach adulthood, so adult providers, and the treatment differs from that of pediatric sickle cell patients, so that's something that would need to be addressed. The longer wait times that sickle cell patients experience in the ER, when we know that sickle cell crisis should be treated as medical emergencies, and the patients having to wait, hours on end to even be seen, and then even after that, not receiving the proper pain management due to the biases of being perceived to be drug seekers when they are presenting in the ER with pain. That's another issue. And the recidivism of sickle cell patients returning to the hospital within 30 days after being released from the hospital. It's clear that
Gina?
Hi, can you hear me?
Hey, you just came
Oh,
back, yeah.
sorry about that. So yeah, so they're the rate of return in the hospital within 30 days because they're not being properly treated when they go to the hospital the first time. They're forced to return to that hospital, or they become what known as hospital hoppers because they're, moving around trying to find a facility and a provider that's going to give them adequate treatment so that they don't have to continue to keep returning to the hospital.
Yeah, absolutely. Definitely some things that have come up at our other meetings is the lack of qualified physicians and the lack of training. We've had a number of nurses talk about how sickle cell is sometimes treated as, being taught in a matter of 2 hours, and that's all the time that's spent on it for the entire year. So really something that's an important speaking point. Next up, I'd like to introduce Brenda Green. Brenda is a married mother of 3 from Columbia, South Carolina. She's an engineer by profession, but is the founder and CEO of a nonprofit, the Be Strong Group, by purpose. She founded the nonprofit in honor of her son, Braden, who has sickle cell disease. The Be Strong Group's mission is to spread awareness of sickle cell through education, advocacy, and empowerment. Turning the mic to Brenda for opening remarks, including touching on the core needs of the sickle cell community at this time.
Good evening, everybody. This is Brenda Green, and I hope that you all can hear me. I am moving, trying to find a spot outside of the storm. I'm so happy to be a part of this conversation this evening. And our nonprofit really was founded because of the lack of awareness within our community. And to be honest, I think that's the core need is the more awareness. And like I mentioned quite often is, especially in our community, we are amongst our employers and our other coworkers and physicians and nurses and, within the community. And I think a lot of that once we spread awareness and which includes education of within the medical field, I think awareness can help with a lot of the misconceptions and misunderstandings and just basic lack of knowledge of sickle cell disease. So that's a part of our mission is to spread awareness and the more people that know, the more people that can have more empathy, the more people that can just support the cause in itself for more research, for more funding. So that's where I stand, spreading awareness within our community. Thank you.
Yes, absolutely. So important to inform people about the things that are truly happening. And I think that's, speaks to why it's important for us all to come together at least once a month and, talk about kind of the current situations and try and raise that awareness. Next up, going to be passing it to Osase. Osase was diagnosed with sickle cell disease when she was 3 years old. After having a life threatened by a sickle cell crisis in 2020, she decided to undergo the bone marrow transplant. Osase is currently 7 months post-transplant and is the founder and CEO of Sickle Cell Warriors Collective Corporation, a digital... Oh, sorry. My internet is cutting out. Hello, can everyone hear me? Sorry about that. Okay. A digital company that unifies warrior voices through storytelling. As a sickle cell advocate, Osase sits on the advisory board with the Rare Blood and Bleeding Disorder Clinic in Calgary, Alberta, and is a member of the Sickle Cell Advocate Board of Calgary. Osase's goal as a warrior is to be an advocate and to eradicate discrimination in the healthcare system against sickle cell warriors. Turning the mic to Osase now for opening remarks, including touching on the core needs at this time.
Hello, everyone. Can you hear me? Because I'm on my headphones. I just want to make sure I'm
Yep.
audible. Okay, perfect. Thank you once again, Spencer, for having me and saying my name perfectly. You're getting it right. I would say that one of the core needs Apart from discrimination and all, one of the core needs is funding. I agree with Shakira. I agree with um, everyone who's spoken so far, but funding is important because little things as hydroxyurea, even here in Canada where healthcare is free and it still costs a lot of money to get hydroxyurea as well. And also funding for little organizations, non-for-profit organizations. It's very hard actually finding funding for initiatives that we want to do or we want to start for sickle cell warriors that require us to physically maybe help a sickle cell warrior purchase hydroxyurea or help them with like fertility procedures, things like that that come up with complications of sickle cell disease that are not funded by the government. If we had enough funding, we'll be able to actually put our funding to physically and intentionally helping warriors. So I think funding for small organizations, funding for research in itself. I do see online that there has been money allotted to certain communities for sickle cell disease, which is great. But I think there's never too much funding. And yeah, so funding is very important with sickle cell disease. It causes intentionality in helping warriors. Um, and this is Osase. And that's all I have to say. Thank you.
Absolutely. Next up, I would like to introduce Monica Rockwell. Monica is a patient and patient advocate living with sickle cell disease and congestive heart failure. She is the founder of the SWGA Sickle Cell Awareness, whose mission is to make sure adult patients have access to medical resources. SWGA Sickle Cell Awareness YouTube channel is where she documents her journey and shares her resources globally. I'll pin a link to that in a second. Turning the mic to Monica for opening remarks, including touching on the core needs of the sickle cell community at this moment.
Good afternoon, good evening, good morning, wherever you're listening from. I, being a patient myself and being diagnosed as an adult, the core needs for me are the resources for adult patients. There are more resources available for pediatric patients versus adult patients. It's very challenging finding resources, finding a physician to treat an adult patient, finding a medical team, or finding resources for adult patients. Raising awareness is the key. Education plays a huge role in identifying the core needs of patients living with sickle cell disease, because I think a lot of it is a lack of education, a lack of compassion, and a lack of just knowing what sickle cell disease is. That's why every year I put on 3 resource events to share what there is a medical team that every sickle cell patient needs. Their medical team, the resources, as well as uh, dealing with the complications of sickle cell. A lot of people that don't know what sickle cell is, but what's worse is when they don't know what the complications of sickle cell is. And that is one of the core needs of sickle cell, knowing what sickle cell is and focusing on the complications of sickle cell.
Absolutely. Yes. And I just pinned your YouTube to the top of the room in case anyone wants to take a look at some of the videos that Monica is posting. Really quickly, I'd like to pass it back to Dr. Kato if you are able to come off mute and share some opening remarks with us.
Great. Well, thank you, Spencer. Now I know where the unmute button is, and I can join more quickly. Well, as a hematologist and physician who's been involved in the care of children and adults with sickle cell disease for over 30 years now, I can say that I completely hear and validate all of the items that have been brought up by all the people who preceded me, by Shakira, Gina, Brenda, Osase, and Monica. Every one of the things that they've said, I've seen year in and year out in my time as a hematologist for sickle cell disease. And all of these are important core needs in sickle cell disease. I've directed my focus in the last couple of years, in particular, what Shakira brought up, which is that patients with sickle cell disease need more treatment options. Many other diseases, and now many other diseases that are considered rare in this country, as sickle cell disease is, have more treatment options available to them. And I've been working within my company to aim to have 3 different classes of treatment options, to have options to treat and prevent the complications of sickle cell disease, to treat vaso-occlusive crisis when it occurs, which we have no treatment options that really make vaso-occlusive crisis episodes better when they happen, and thirdly, long-lasting or curative treatment options, not only stem cell transplant, but gene therapy and other approaches that can make the disease much better or cured for a lifetime. And that's where we're aiming within our company, to try to make more options available for patients with sickle cell disease. And that's my introduction.
Wonderful. Yes, absolutely. I think more treatment options is a super important step towards providing that care that is really necessary. Lastly, I'd like to introduce Donna Sullivan. As a rare disease mom, patient advocate, writer, producer, and health activist, Donna has spent the last 10 years supporting children and families living with rare disease and complex pain conditions. She serves as a board member for the Coalition Against Pediatric Pain. As the director of patient advocacy at Pathways to Trust, she works tirelessly to elevate the patient voice and raise awareness of the unmet needs of vulnerable medical populations who experience higher hurdles to care. She hosts educational forums for patients and medical students that focus on trust and communication to enable better health outcomes. Her work is focused on raising awareness of rare disease, patient challenges, healing medical PTSD, and reducing stress of trauma for both physicians and patients. Donna's going to be helping co-moderate this event, so really thankful to have her on the panel. Turning it over to Donna to touch on the core needs, give the opening statements, and yeah.
Thank you so much, Spencer, and thank you everyone for inviting me here. This is my first time moderating this room, and I apparently did a really bad job, Dr. Kato. I apologize, I didn't see you initially. But I want to thank everybody for being here, and I absolutely agree with all the sentiment that I'm hearing about the needs. Unfortunately, there's way too many still at this point in time. Obviously, funding and finding qualified physicians is a big one. A lot of the work that I do has always focused in the pediatric pain space, and one of the areas that I'd like to add to kind of the long list of needs is the transition when kids are being transitioned to adult care. Sometimes it can be a little bit like the Wild West. And as we all know, you're a sickle cell patient, but you're also a human being. So things like wanting to start a family or missing a lot of school, these are the kind of what I call the collateral issues that we deal with as a chronic pain patient and as a patient with sickle cell disease. So I think when I look at the core needs, in addition to all the ones that have been so eloquently stated, the work that we do at Pathways to Trust is working with medical students and going in and doing, it's almost like communication training. It's really talking to them about the patient experience and the patient voice. And, we'll explain kind of, have you ever thought about what it took to get this patient to even walk into your emergency room? We all know emergency rooms can be the absolute last place that you want to be, especially when you're in high pain or having a crisis. And then again, that's another area that there's a lot of work that needs to be done. But, I think one of the areas that, working the other side of what Pathways does is we work with patient empowerment and just trying to help patients understand that you are going to run into roadblocks, you are going to run into physicians, you are going to have unfortunate wait times sometimes when you're in crisis. So how do you handle it? How do you communicate and how do you survive it? And not kind of take the burden on, because, mental health is a very important part of overall health. And unfortunately, far too many patients are suffering secondary trauma because of access to care issues. So, didn't mean to go on, but I think in addition to everything that everybody has said, I also think some of the mental health and life support, um, is not there and really needs to be. So I'm Donna. I'm done speaking.
Well, fantastic. Definitely laid out a number of uh, key needs, ideas, items to address. Um, But I think starting off, I think a great place to start would be talking about research and the funding that's going on. And I'd love to get Dr. Kato's perspective as a hematologist that's been in the field for so long, kind of thinking about the research needs and um, things like other treatment options, cures, kind of from your perspective, where is that at?
Well, sure, Spencer. Let me just say that over the 30 years that I've been involved, excuse me, in the care of patients living with sickle cell disease, I've witnessed really dramatic changes. Some things still need, excuse me, some things really need to catch up still a long, long way, but things have changed in a way. When I first started in the early 1990s, there were no treatments except blood transfusion for sickle cell disease. Over that time, we have seen the approval of hydroxyurea. We've seen the beginning of bone marrow transplants or stem cell transplants for sickle cell disease, and that's been great to see. The finding that hydroxyurea could work for sickle cell disease was funded by a government grant from the National Institutes of Health. Since that time, well, let me just say one other thing about the funding at that time was that essentially none was coming from drug companies. There were no drug companies that were interested in finding a new treatment for sickle cell disease. Excuse me, and that the amount of money that the drug companies have to invest directly in drug development is actually higher than what's available through granting agencies for any disease. And so until drug companies joined into the research effort and started investing company money, we were really talking about small money compared to other diseases. Certainly big time diseases like diabetes, hypertension, and so forth that affect a very large percentage of the American public, but even other rare diseases and constantly compared diseases, cystic fibrosis, which even though it's also a rare disease, even more rare than sickle cell disease, it attracted more government funding and then eventually also uh, industry drug company funding. And now they're making progress. When I was a hematologist in my early years, I would never meet a person from a drug company that was coming to ask my opinion about developing new drugs for sickle cell disease. Um, Now, by the time I moved from my university hematologist position, I was in the position where I'd be getting phone calls and people knocking on the door all the time from drug companies asking me to come visit them, give them my opinion about drug development in sickle cell disease, give them ideas, hear their ideas, or to ask us to set up locations at our hospital for testing their new um, uh, potential drugs for sickle cell disease. So this is changing, and it's changed a great deal from the inside. Um, but there's still a long, long way to go. There's really a long way for government funding of sickle cell laboratory research and clinical research by the federal government's agencies, the NIH, the FDA, and other health research agencies in order to achieve health equity for sickle cell disease compared to other comparable diseases. Um, but I have to say, from the drug company perspective, um, they're now buying into the idea that they should be investing in pretty big time. If you consult the government listing of clinical trials for sickle cell disease, 20 years ago, you'd find one or two trials that were open anywhere in the country. And now you'll find 30, 40, 50, 60 trials that are open across the country that are virtually all sponsored by drug companies. So um, I think the drug company community is investing big time in this. The only problem is that this is a slow process. In the best of situations, for any company developing new drugs, they can expect that um, that 19 out of 20, even close to 99 out of 100 um, drugs in early development in the long run won't get approved. They won't work well enough. They have side effects. They have some reason that they can't be approved. And that's going to be true for sickle cell disease too. And so we need all of these irons in the fire if we're going to end up with 1, 2, 3 drugs just over the next few years. It takes that many attempts in order to produce ones that work. But fortunately, we've seen just in the last few years 3 more drugs approved for sickle cell disease: Endari, Adakveo, and Oxbrita, and that's the beginning of progress in this area. And that's what I have to say about that topic.
Well, thank you so much for sharing your perspective. Really interesting to kind of hear about the development, especially over a 30-year time frame. I'd like to pass it to Asase, who was actually able to get one of the newer treatment options, and just kind of hear about her perspective with handling kind of the healthcare system in Canada and kind of how that felt from the patient perspective.
Thanks, Spencer. So for me, I had my bone marrow transplant September 30th, 2021, and with I went through what is it called? So I had the alemtuzumab is what it was called. So that was the immunosuppressant injection in which I was given to suppress my immune system. And then I went through with radiotherapy. And then after the transplant, then you are on 2 antibiotics, you're on an antiviral medication, and also sleeping pills and pain medications as well. And in terms of accessing these medications in Canada, in the hospital, when you're admitted, as long as you're a PR, so permanent residence, or you're a citizen of Canada, all the medications are free. So once you're in the hospital, you're admitted, everything that you need while you're in the hospital is all free. Now, when you're discharged from the hospital, the medications I had to pay for was my antibiotics. I had to pay for my antivirals, any other medications like the Veltrex, and any medications that either one came about, I needed it because of a side effect the immunosuppressant caused, or anything that was not covered under the program here for the bone marrow transplants. So with that, because I work as a licensed practical nurse, I have insurance. I have coverage. However, if I didn't have insurance, I look at the list and I would have to pay thousands of dollars just for my medication. Like antibiotics, penicillin alone is almost $200 just for the bottle of a month. And in terms of the accessibility of medications for Canadians, I would say it is better if you're coming from a place of insurance, if you have insurance. Otherwise, I would say it's the same in the sense that you will have a lot of cost under your belt. I think that we need more insurance companies to insure sickle cell patients, because that is something that I've heard that is not It's currently not something that they do, at least here in Canada. Insurance companies, once they hear you have sickle cell disease, they don't care about having you insured, because to them, one, I think it's they don't even know what sickle cell disease is, and two, it's, oh, there's no cure, so you're a lost cause if we do insure you. But in terms of accessibility to medication, easy to access, just a lot of money. And for me, I had to freeze my eggs before I went ahead with the transplant. And freezing your eggs falls under quote unquote cosmetics. So our government does not cover anything that falls under the umbrella of, oh, it's cosmetics. So in their opinion, you don't need it and you're choosing to get it. So for me, I had to pay over $9,000 out of pocket for me to be able to undergo my to freeze my eggs. There was a grant that gave me 3,500. However, I have a friend who was not eligible for the grant because when she filled out all the requirements, they said, oh, her parents were making enough money, she was making enough money and was not eligible for the grant. So she had to outsource that $9,000, $10,000 to pay for her freezing of eggs. So I would say in terms of accessibility, great once again, but again, it's still a lot of money for us to cover as sickle cell patients, and there are not enough grants, there are not enough programs that say, okay, we will help you if you're low funding. So I think it's still needed on our end here in Canada as well.
Osase, can I ask a question? And this is just my own naivete about Canada, but can I ask, do you feel that you had, how is the pain management in terms of, from a long-term standpoint? Do you feel like you're adequately supported? Do you feel like it's difficult when you go in crisis?
Okay, so for me, so I live right now in Calgary, Alberta. In Calgary, Alberta is where my main hematology is, and it's a bigger city than other cities in the province of Alberta. If you're in Calgary, Alberta, if your home base is Calgary, Alberta, I would say at the hospitals in Calgary, Alberta, it's a lot easier when you go into the ER because your hematologist who also resides in Calgary can be on call, and you're able to call them and they're able to, since it's the same, Canadian Alberta system, they're able to look at your documentations a lot easier. They're able to look at what medications you have in the past, and it's easier to get through. However, I've also experienced rural areas because working as a nurse, I work in cities where it's only 13,000 people as opposed to Calgary that has over 100,000 people. Over there, it's a lot harder, and it's not about the wait time. It's more about when you get into the hospital room, they don't know what to do with you, and they're not they're not also listening to what you think has to be done. And so a lot of the times, I don't know what system they have necessarily. It's hard for them to access your records in a bigger city because they're rural, so they don't have all the technology that is required. And two, there are certain medications that some of their nurses might and doctors might not be certified to administer at a higher dose. So like what is hydromorphine, for example, my dose was 3 milligrams. Some doctors do not feel comfortable recommend prescribing 3 milligrams. However, if you're in a bigger city in Canada, like Calgary, Alberta, there are lots of doctors with the ability to prescribe 3 milligrams and more if you needed it. So with Canada, it depends on your province and also depends on the city in which you reside in the province. But I will say Calgary, Alberta, because my nurse, Trudy Sales, is the lead nurse in the sickle cell clinic here. She is very good at what she does. So she's the main advocate for a lot of us. And because of her work, we're able to actually get seen a lot quicker than if we were to go to a rural city whereby they do not have a specific sickle cell nurse. I hope that makes sense.
No, that does. That makes perfect sense. It sounds like you do have a lot of the same issues. And we have that same thing here, obviously, with geographic location. It can really make all the difference in the world. My kids and I used to laugh about it's kind of like the lottery. You go in and you hope you get a doctor that understands what you need and
Yeah.
is able to deliver it. Yeah, and obviously geography is another big part of it. So thank you so much for sharing that. I
No
appreciate it.
problem.
I want to give Maya an opportunity to speak. Maya Bloomberg is with us, and she is a board certified family nurse practitioner at Sylvester Comprehensive Cancer Center and Jackson Memorial Hospital. She earned both her bachelor's and master's of science in nursing degrees from the U Miami, and she's worked as a hematology nurse practitioner for over 7 years, specializing in sickle cell and bleeding disorders, which shed light on the significant health and racial disparities that exist in modern medicine. This led her to create a social media page, the HemNP, devoted to providing reliable information to sickle cell patients so they can better advocate for their health with hopes of bridging this disparity. So I'm going to turn the mic over to you, Maya, because I know you only have a little bit of time, but want to thank you so much for joining us.
Good evening, everyone. Sorry for my tardiness. I wish I could stay longer, but hopefully we'll be able to have some meaningful conversations in the interim. But I think my bio said it all. I'm a huge sickle cell advocate. I advocate for everyone in just chronic illness and invisible illness. And I feel like with sickle cell specifically, we all know it is extremely stigmatized and misunderstood. So if there's anything that I can do to kind of help just raise awareness and help from the provider standpoint, it really is. I like have this altruistic sense that just keeps pushing me to continue. So I'm happy to be here tonight and have some conversations with some familiar faces up here.
Great. Thank you so much. We're glad you're here as well. It's funny because that's one of the things at Pathways. We try to do a lot of work with different nurses and nurse practitioners because, and no offense, Dr. Canto, because obviously physicians have a very important role too, but the nursing oftentimes is more point of contact for the patients. So thank you for the work that you do, Maya. Does anyone else want to contribute to the conversation? We want to invite anybody that's here in the room that has not been invited up to speak. If you'd like to speak, raise your hand and we're happy to bring you up to the stage to participate in the conversation.
I just wanted, this is Gina Glass. I just wanted to mention that for me, when I think of access, um just just because, I'm sorry, I don't want to pronounce her name wrong. Assessa, she was mentioned. Osasa, thank you. So you mentioned that there was that you guys have the access and availability for like medications and stuff, but the pricing can be, exorbitant. To me, if it's not affordable, to me that means that there's an access problem, because if we can't afford the medication, even though it's available, it's ready, it's there, if you can't afford it, then that means you're not going to get it. To me, that's my train of thought. Here in Nevada, there's about 1,000 people who live with sickle cell disease. Um, in 2019, we were able to get a sickle cell bill passed. So in that bill, um, we because of my experience as a caregiver, I was hesitant, am hesitant, or apprehensive about giving my daughter hydroxyurea. So here, I don't know how it is in other states, but here at the time, hydroxyurea was only available to in the pill form. So me, as not being a pharmacist, I didn't want to have to guess and open a pill and shake it on some food or in a drink to give my daughter her medication. So the bill that our organization and other advocates here fought for, we asked for there to be language in there for Medicaid to pay to compound that medication, because if you wanted the medication to be compounded, which is made liquid form, you had to pay like an extra $80 to $100 out of pocket, even if you had Medicaid. So, with a lot of people that have sickle cell being on fixed incomes like Social Security, that's a burden to have to come up with $100 a month on top of everything else. So we were able to get our bill to include that Medicaid would pay for the compounding of medications. And now that we've also had several new medications come to market, our bill also includes language that any new FDA approved medication made specifically for sickle cell, Medicaid has to pay for if it's prescribed by the medical provider. And also, supplements. So many individuals with sickle cell take different supplements, mainly like folic acid, vitamin D. So those were supplements that you had to pay for out of pocket. So with our bill, we have requirements now that Medicaid has to pay for supplements, those type of supplements, if they're prescribed by their provider. So that takes, some burden away from, access to their medication. I've talked to several patients who were paying like $40, $60 a month for their supplements because, everything else that they needed was covered by their Medicaid, but not their supplements. And even as recently as a month ago, I found out that a patient had still been, after this bill's been passed for what now, 3 years, their Medicaid provider was still having them to have to pay. The pharmacy that they went to still required them to pay for their medication. So now we're working on, going back in time to when the bill was passed in June of 2019 to see if maybe she can get some kind of credit for all this time that she's been paying for those supplements when she shouldn't have been. But also, even with that, which is a big win for us, there's still the issue with the fact that that law doesn't apply to any commercial private insurance. So there's still sickle cell patients who have to pay, a lot out of pocket for their medications and don't have the access. So that was kind of the downside of the bill being passed, is that, of course, the state can't control what, private insurers do. So unfortunately, none of those things that, passed in the bill apply to people with private insurance, employer sponsored insurance. And there are a lot of people who have sickle cell disease that also work. So we have a nurse on the line right now. So unfortunately, those are things that won't apply to them. So that's where funding and things is important, because there are people who, yeah, they probably might make a decent wage, but having to come up with hundreds of dollars or thousands of dollars for medications just to maintain their quality of life, they might not be able to do that, as easy with managing the rest of the responsibilities that they have.
Can I piggyback off of that? Because I just want to make sure that you're aware of different resources that are available in the United States for medications. Because what's interesting is I live in Florida, so when it comes to access to medications and insurance coverage and all the prior authorizations that I have to do, it's insane, and they make it extremely challenging to get patients on medications, especially for opioids. The policies that we have are very challenging, but I find there is more issues with the Medicaids and Medicare with access as opposed to the commercial insurances, because a lot of the drug manufacturers for hydroxyurea or your iron chelators or the newer medications like voxelotor, Brenda, they have copay assistance programs and different financial resources, but then it's challenging for the ones who are government funded insurances because they don't qualify for these type of reimbursements. So then we have to kind of seek support from third party foundations. So I think it's important for patients to know how to advocate for themselves and speak up if you are having issues with medications. Like, I think as a provider, one of my biggest pet peeves are when patients are just being labeled as non-compliant or non-adherent to their medication, because I think as a provider, we need to assess, why is that? Just don't put a label, because how is that helping the cause? Are they non-adherent because of side effects of medication, or is it because of not having the financial resources to afford the medication? The same applies for, why are people missing their appointments? Is it a transportation issue that we can try to come up with different resources to help them with that? So I think it's important for patients to feel comfortable with their providers and speak up. There's definitely a shortage of resources. I mean, I work for a hemophilia treatment center, federally funded in South Florida. So I do 50% that, and the other 50% I do a sickle cell. And from day one, it was so obvious the disparities. You have sickle cell, which affects around 100,000 people in the United States, compared to hemophilia affecting maybe 25,000 people. But the number of treatment options, the amount of research that's going on, the number of resources and funding was just exponentially higher for a condition that was so much more rare. So we still are lacking resources. And I feel like when I speak to different pharma companies and they're trying to pick my insights to see what's necessary from a sickle cell standpoint, I always highlight that they need more social services to provide to these patients, so access isn't an issue when it comes to medications or coming to visits and appointments. I think for narcotics and opioids, that's a huge issue. I mean, we had this huge opioid crisis, and unfortunately, in order to curb that, they put a lot of restrictions and policies in place that are negatively impacting our sickle cell patients, where all of a sudden I've been following the same patient for almost 8 years now, and now I'm all of a sudden having to do drug tests for them, which I feel like there's already a distrust against healthcare providers. So now if all of a sudden I'm like, hey, I'm going to be doing drug tests every 3 months on you, but I'm only doing this because I need to check off that policy box in order for their insurance to approve, plus having a paying contract. That's another issue that we were meeting with the Medicaid and people who lobby for those type of policies to try to explain that when you're looking at a policy for sickle cell versus cancer, when it comes to opioids, it should be more or less a similar approval process, because as soon as you have cancer as a diagnosis, that's the end of the prior authorization. Where with sickle cell, it asks, do you have a pain contract? Do you have a urine drug screen? So I think there's a lot more that we can be doing to help with access, whether it's from supplements and vitamin D. I mean, Medicare doesn't cover vitamins. So we know that sickle cell, I mean, just in general, vitamin D deficiency is extremely prevalent, and it's more common the more melanin you have in your skin. So with sickle cell, we know that low vitamin D can actually be associated with increased bone pain. So I have the majority of my patients who are on high dose vitamin D supplements, but Medicare doesn't cover that. So just because they have a policy of not covering vitamins and supplements. So I think things like that, it creates an issue, because I have patients who then are going to get avascular necrosis and other bone complications because they don't want to pay out of pocket. And if they're not bringing it to my attention that it's not covered or that they can't afford it, I'm not going to know that they're withholding a treatment that has some benefit for their health outcomes. The only other comment that I wanted to say, because I know Asasa was telling us how it is in Canada and with her fertility preservation and things like that. And I recently learned, because when it comes to fertility preservation and storing your eggs, it's extremely expensive, that CBR Connections actually has a program specifically for sickle cell patients where they'll bank your eggs for 5 years for free. And then I know there's somebody, I don't even know her name. I just know her Instagram account, that she has this whole thing where she's trying to fund fertility
Yeah,
preservation for sickle cell
yeah,
patients. Yeah,
SC,
Tiana. Thank
yeah,
you. Yeah,
Wolford.
exactly. Tiana Rayford, something like that. But I think it's important for patients and providers to be aware, because my patient's actually the one who told me about the egg preservation banking for 5 years for patients, because otherwise I would have never even known about that service. So I think for patients, just speak up, and when you're having issues, make your provider aware, because we're not mind readers, and sometimes there are services and things that we can do to help you and just make your life that much easier, or just a slight bit easier living with sickle cell, especially when it comes to working, if you need to request accommodations or FMLA, or if you're in school and want to request accommodations for extended test taking. There's so many things that we can do to just slightly lessen the stress of living with sickle cell when it comes to work and whatnot, that just speak to your provider so we can help you as much as we can.
Absolutely. Also, I think that as far as what Medicare, Medicaid covers, that's also something that the community-based organizations can fight for. So I feel like every state should have a sickle cell bill. Our bill that we passed here, there was no funding attached to it, but I believe that the laws that were enacted because of it, the language in it is kind of priceless. We now have a sickle cell registry to get an accurate count of the patients here. Medicaid is covering supplements now. Medicaid is going to cover any sickle cell medication that comes to market. And that's something that, other advocates and organizations can, band together and talk to their local legislators to get a bill like that passed in their state. So that way there's not that issue with, a patient foregoing getting their supplements because of the, 30, 40, $50 they have to spend monthly to be able to afford such a supplement. There's, legislation that advocates can go ahead and, find a legislator that will sponsor a bill and push it through to be able to address some of those disparities that sickle cell patients experience. And that still comes with working with your providers, and definitely advocating for yourself with your provider. My daughter started Indari at 3, and at first it was, denied by her insurance because the required age at the time is 5. But I made the case that, she's like 3 feet tall. She's the size of a 5-year-old, and I believe that if she had this additional supplement, this medication that's for people with sickle cell, that she could greatly benefit from having it. And my provider went ahead and did whatever she had to do on her end, and then the next thing you know, we're getting Indari now. And so she's 7 now, so she's been on Indari 4 years, whereas if you just look at the eligibility, it says 5. So there's probably, parents that are like, oh, my kid can't get it until they're 5 years old, when that's not the case. If you advocate and you are transparent and talk to your provider, then you might be able to get things that people feel might be impossible, or you might have to wait to get.
Yeah, I also completely. Oh, sorry. Go ahead, Dr. Gregory.
Oh, I was just going to congratulate Gina for the great work in your state and for the way that Medicaid is covering things. But I missed which state you're in.
Nevada.
Yeah, that's wonderful. I think it would be great if we actually had federal legislation that covered all 50
Right.
states that would accomplish the same things that you have.
Thank you.
I just wanted to welcome Sandra Washington. Sandra, I saw you raise your hand. I want to welcome you to the stage. If you want to introduce yourself, please do.
Good evening, everyone, or good afternoon, everyone. Not sure where everyone is. My name is Sandra L. I am a board certified patient advocate. I also am the owner of MediHelps LLC, which is a board certified company. Gina, I want to thank you, and I want to tell you that my hat goes off to you because you are a strong patient advocate. You advocate for not only yourself, but you advocate for others. There's a problem with patients not speaking up, and patients not knowing what they can do, who they can talk to, what help is out there, what help is ready to, just sitting there waiting for someone to call and say, hey, I'm having this problem. Can you help me? We have to have more of yous out here in the world who are not afraid to speak up, who are like, yeah, no, I know what this normally is supposed to be like, but I'm not settling for normal. Me and my child, or me and my family, or whoever, we're not settling for normal. We have to, as patients, we have to push that notch. We have to push the envelope. We have to make the American and the global health community do what it should be doing, which is making sure that not only is healthcare equitable, but it's also equal. So no matter what condition or what you're going through, you are receiving the same health care and at the same optimal level as anybody who was perfectly fine that never has to see the doctor. That's good for them. But guess what? I do. And I need for me to get not just care, I need to have optimal care. So thank you so much for being that voice in the wilderness who's like, yeah, here I am. I'm in Nevada, but here I am. And hopefully others that are listening to this that might not live in Nevada, may live in another state, might say, hey, I need to talk to her to see how we can have that happen in our state. And I'm with the doctor. It should be federal. It should be global, that these things that patients need are readily available without them having to jump over hoops and hop through, obstacle courses and do all kinds of crazy things just to get health care. We've got to do better. The society as a whole has to do better. So I thank you so much for being that voice. And I will pass this back to you, Miss Donna.
Thank you, Miss Sandra. I appreciate that, and I'm here to share my information and experience with anybody in any state, so that you can, wherever you are, you can have a sickle cell bill. It really isn't. It's a challenge, but it's not as hard as one might think it is.
Georgine, can I ask you, do you know how many other states have similar bills? Because I'm curious. I really do agree that, there has to be effort being made towards a federal movement. But do you have any information about any other states that have been as successful as Nevada?
There are maybe a little over a dozen states that have sickle cell bills, but I honestly don't believe, I've only read a couple of them. I don't believe they're as let's see what I was saying. They're as uh intensive as ours, like the things that we ask for, the things that are in our bill. I don't know if the other states, the couple I've read, they didn't have the type of language that we had as far as what Medicaid had to cover with the supplements and the other medications for sickle cell. They didn't have like we require the state to establish a sickle cell registry. So because in Nevada, when we say there's 1,000 patients with sickle cell disease, that's like the best guesstimate. The CDC listed about 500 sickle cell patients in Nevada in 2007. So we haven't actually gotten a count of how many patients are in Nevada with sickle cell disease since 2007. So what's that? 15 years. And we all watch the news, so we know a lot of people are moving to Nevada, Florida, places like that. So those numbers have surely changed. And we know that at the childhood clinic that we have here, they see about 300 children with sickle cell disease. So it's just the best guesstimate is 1,000, and that's not even the most complete accurate number because we just established a registry, and because of COVID, it hasn't been able to be worked like it should be.
Wow, but that's really hopeful and that's impressive. And I'm going to take that on as my homework before the next time we get together. I'm going to do some research and get some more information, kind of about the status in all the states, because clearly you guys are leading the way on some really important issues, especially the supplements. That's so impressive, because as we all know, that can break your bank right there.
Really quickly, Gina, if you have the time, I'm really curious about what that process of going through those policy changes looked like, just in case there's any other advocates out there that are thinking about doing it for their own state, kind of giving them an idea of what this process feels like, how it went for you.
Sure. I'll be completely honest. Um, I actually met the legislator that sponsored the sickle cell bill. I met her at a barbecue, and she said, "Hey, I'm working on a sickle cell bill." And after she told me that, I basically just began harassing her and connecting her with any and everybody else that I knew of in Nevada that supported and was knowledgeable about sickle cell. So we have a pediatric hematologist here, and she's very passionate about sickle cell. She, in residency in New York, she treated patients with sickle cell disease. So that's her passion, and that's what she's been doing since she's been in Nevada. So I pretty much connected her with that hematologist, and we literally Nevada is kind of small, and there was really nothing about sickle cell here until 2016 when I moved here with my daughter with sickle cell. So we were able to be really hands-on with the drafting of the bill. I don't know if that is common everywhere, but I know we were able to literally say exactly what we wanted for the bill. But it's pretty much, we presented the information to the legislator. She went back to like her legal and the people who actually write the bill on their side, and we had a couple meetings with some Medicaid insurers, and cool, and we and she drafted a bill. She sent the bill to us, what she drafted. Then we came back with things that we felt would be more beneficial to the sickle cell community here in Nevada specifically, and asked if she would, review them and make the edits, which she did. And we had a hearing. We came out, we testified. So myself, I had an experience with a hospital out here where my daughter, she went in because she was having a high fever and such, and they didn't really do too good, and they sent us home, and we had to drive an hour to another hospital that was in a more urban area, and it came to be that she had pneumonia in both her lungs and acute chest. So at like almost 2, she got her first transfusion and was in ICU for over a week. So I was able to, I reached out to them. They ignored me. And then I reached out to my, and I don't think when I reached out to my assemblywoman, and she was able to facilitate a meeting with myself and the chief medical officer of this hospital. And I told him my experience. And it just so happened his son has sickle cell disease. So he, could relate, and that hospital wrote us a letter of support for our bill. And I met her in June of 18, and pretty much by June of 19, they passed the sickle cell bill. We got a couple more legislators to co-sponsor it, and the bill was passed. One of the reasons I think it was passed so easily is, of course, a big reason, we weren't asking for any money. So bills where you're asking for money are always going to be more challenging to get passed than a bill where you're not asking for any money. So like we have the sickle cell bill, and at the same time we also got rare disease advisory council enacted here in the state. But those were two things where we weren't asking for money. So other bills that people have attempted to pass, they were asking for money. So of course they said no. And our bill was actually used by the lupus community, and they basically just used the whole blueprint of our bill. And now there's a lupus bill in Nevada that pretty much has the same similar language. So our bill, after that, we see that our bill can definitely be used and duplicated in other states that are looking to have sickle cell bills. So, we're happy to share the bill that you can look at, and you can tailor it to fit the specifics of the sickle cell population in your state. So yeah, it's to me it was pretty simple, but I've talked to other people and I've heard that, getting bills passed is maybe a little more cumbersome, but it seemed pretty simple to us, and we're open to, talk with whoever and share the information about our bill. I think you can go online to the Nevada legislative or something and actually just type in sickle cell and see our bill in its entirety.
That's absolutely awesome. Yeah, and I think we definitely will do that. I also, being the fastest Google in the West, is my kids' joke, I was able to get a little bit of information that I did post up there in the group. Just talking about a bill that was presented December 2021 by Representative Dan Davis out of Illinois, Michael Burgess out of Texas,
Okay,
and
yeah.
it is to support sickle cell. So, that might be something else to research and see, to jump on a federal level. But Nevada could absolutely be the case study, right? Just showing that it can be done. So,
Baltimore has a good sickle cell bill as well. I think they might have two.
well, and that's a great segue, because I see Tanika here here on the stage now. Tanika Hoffman, I want to welcome you because I believe you're from Maryland, right? Would you like to introduce yourself and join the conversation?
Of course. Hi. Yes. Can you all hear me? Because I'm connected to my speakers. Just want to make sure you guys can hear me okay.
Yeah, we can hear you great.
Awesome. All right. Hi, everyone. So my name is Tanika Hoffman. I'm the ED of the Maryland Sickle Cell Coalition. I have sickle cell disease. This year, as a matter of fact, 2 months ago, we just passed our first sickle cell bill attached with funds. We partnered with Johns Hopkins, the Maryland Sickle Cell Association of Maryland, the Maryland Sickle Cell Association of Eastern Shore, and we first started doing what we call Annapolis Day, where we did digital rooms where we invited representatives from every county in the state of Maryland to come speak with sickle cell patients, caregivers, constituents. We broke down the digital rooms based upon the county. And so we were already working with a lobbyist to craft this bill. And so we were able to get through a little bit easier because we employed a lobbyist. So this is SB Bill 1188. There was $1.4 million attached. And the funds are to be sent to highly populated sickle cell regions in the state of Maryland to provide services for like community health fairs. Because what we know in the sickle cell space is a lot of individuals, especially in the Black community, don't understand the inherences of sickle cell disease. We have a proclamation that Sickle Cell Awareness Month is now September. We also have relaunched our steering committee where individuals from the state of Maryland, so representatives from Hopkins, the local hospitals, University of Maryland, and the Sickle Cell Association, meet every month. And we are tasked to identify issues and problems within Maryland and then go back to the state to recommend what it is that we need to work on. So, for example, just because you put up legislation doesn't mean everything that you want is going to get approved. We wanted a sickle cell registry because we don't know how many sickle cell patients are in the state of Maryland, and they didn't approve it. So they kicked it back to the steering committee. And so next session, we're going to be advocating and pushing for this registry. And so I'm a big proponent of grassroots marketing, grassroots organization. If you want to build trust and let people know about what you're doing, you have to hit the ground running, knocking on everyone's doors. And so the Sickle Cell Coalition of Maryland is a new organization. And so I've been meeting because I'm right next to DC with a bunch of people. And I think it's important because, in the rare disease space, a lot of people don't know about your disease. So you have to be willing to get out there and just be honest and open and ready to receive feedback. So I'm sorry I'm late. I just found out about the event. Gina invited me. I'm out walking my dog, but I'm happy to be here and answer any questions.
Absolutely. Well, we're super excited to have you, and just putting it out there that we host this room monthly on the fourth Thursday of the month. So, we're sticking to a monthly schedule, so we'll always be here anytime anyone's available. So,
Yeah, and also just it is the fourth of every month, but feel free to follow each other. Feel free to contact, and I think it's really important to kind of keep the conversation going, even when we're not meeting, because I think as you had just said, Tamika, you got to kind of hit the ground running and stick with your community. And if anyone has any topics or initiatives or things they want to share, please do, because information is power, and sometimes you could stumble across someone who could help you get to that next step. So definitely make sure you follow everybody in the room.
yep. And, speaking of next steps, I think this is a pretty good time to kind of ask for two things from everyone. So the first is closing remarks, thoughts about the conversation, thoughts about what's needed and kind of what next steps are going to look like. And then another thing is recommendations for the room. We're always trying to improve the production, improve the quality, get really important, pertinent panelists. So if anyone has recommendations for people to reach out to or connections for the room, that'd be wonderful as well. Or just suggestions about format, themes, um, anything like that. So I'm just going to go in the order of how I see the panelists on my screen. So starting with Monica. So, how can we improve the room, and then closing statements for the discussion. Pass it over to you.
Okay, it was a great discussion. I enjoyed the discussion and I learned a lot from Georgine because legislation is a big part of what we do. One of the things that I wanted to add to this conversation also is the communication between patients and the medical team. Sometimes there's a gap there. So sometimes patients aren't able to communicate what they want or what they need. And I think that would be the next thing. There are a lot of patient advocates. We're very educated and very knowledgeable of sickle cell issues and topics, but for the patients that some of us advocate for, their education is not that high. Some of them may have a high school education, or they may not know how to communicate. Let me just use that word. They don't know how to effectively communicate. And I think that's something that should be addressed as well in this communication. And that's a part of the equity in sickle cell. Some people don't know what they don't know, or they don't know how to tell you what they need. So I think that should be one of the topics that we discuss: how can there be effective communication between medical providers as well as patients. That's how I want to those are my closing remarks. Thank you.
Absolutely. I think we can definitely spend a long time at our next meeting talking about that, because it's a super important thing to bring up. Next up, going to pass it to Shakira for closing remarks and also recommendations for panelists or themes for the room.
Hi, definitely want to just say amazing, amazing conversation. I'm so, honored to be a part of this conversation. It's definitely got my wheels turning on things that I can be doing more here in Georgia with my organization. So, awesome work to all of you. It's been great to be a part of the conversation. I do want to recommend someone who is in Atlanta, Georgia, who has a nonprofit who does a lot of community work for sickle cell. Her name is Mapiller. I'm not sure if you all have ever had her on before, but she has an organization called My Three Sicklers, and she has three daughters who have sickle cell, and she's just an amazing advocate. So I think that would definitely be a benefit. I also think that how to access a conversation that we could be talking about is how to access these clinical trials, and just where all the different places that we can be looking. I know sicklecellconnect.com is a great resource for particularly adults with sickle cell disease, but as a caregiver, I've definitely gone on there. They offer free counseling sessions for sickle cell warriors, and also caregivers of sickle cell warriors if you're under the age of 18. So it's offered through Be the Match, which is the National Bone Marrow Registry, and I just think that it's a great resource for sickle cell patients. So sicklecellconnect.com is a great resource that anyone with sickle cell should really look into. They also publish like different articles about different topics and things like that that could be helpful, and they have a ton of clinical trials on there that you can access. So I think that could be another topic of discussion, because that's only one place to find clinical trials. I'm sure there are plenty other places that we could be highlighting and discussing. And I just want to say thanks for having me. It's been a blast, and I will definitely be back again. So thanks so much.
Yeah, well, we absolutely love having you here, and I've just pinned that Sickle Cell Connect at the top for anyone that's interested in taking a look at that. Next up, going to be passing it to Dr. Kato for closing remarks and recommendations for the room, including panelists or format. Dr. Kato, over to you.
Yeah, I've really enjoyed this conversation. I've been so impressed by all the people in the room with me. And I want to thank all of you for giving me the chance to be in the room with you. I'm particularly impressed with the discussions about enacting legislation in your own localities, states, and at the federal government level. I participate in a lobbying group called the SCD Partnership to try to aim for policy changes in the U.S. government, but all of these things can be very slow, multi-year processes, and I think further discussion among the group about the specific approaches that Georgine and Tanika outlined as examples for blueprints in everyone's states. I think this could be a great topic for more detailed conversation, because I think it does really empower people to make their voices heard and have it result in legislation that has a broad impact to everyone in the state. I think this is really a conversation that could have real ramifications and high impact as a future topic.
Yeah, absolutely. It could warrant 4 more sessions because there's so much there. I'm going to pass it to Gina to give closing statements and kind of recommendations for the next room.
Thank you guys so much for having me. I just want to, I guess, starting with a recommendation. I think that it would be great to actually have a conversation about transition, because that's something um that's needed. I think across, nationally, pretty much most states probably don't have a transition strategy or program or such, and I think that's something that's very important in a patient with sickle cell's life and journey with the disorder. So I think that we should have a conversation that touches on that. And also, like Maya mentioned before, I think she's off now, but about the resources that are available to patients, like the patient assistance programs, assistance with transportation, and things like that. I think it's important that that information is disseminated to the community, because just in talks I have with patients, there's a lot of patients who aren't aware of all of the resources that are out there to assist them and make sure that they can manage their care better, because with having access to the medications or transportation to make it to their doctor's appointments. We actually just were awarded a grant from Global Genes to address financial advocacy in the rare disease community, and we're going to be creating an ebook that's going to outline our sickle cell bill to our patients here, because of when it was passed with pandemic right after, there's a lot of patients who aren't aware of the bill and of the benefits of the bill. There's a lot of providers that are not aware of what they should be adhering to as a result of that bill, and the Medicaid insurers may not be clear or adhering to the rules that they need to adhere to as it pertains to the language in that bill. And then to touch on the other benefits that come with your health insurance, aside from just doctor's appointments and emergency room visits. There is transportation that's available with your insurance for Medicaid policy holders. I talked to one insurer, and they also offer like rental assistance, housing assistance. So there's a lot of benefits that come through some Medicaid insurers that would benefit, our patient population. So we definitely need to work on how to make sure that all of these patients are aware of all of the resources that are out there. I appreciate being on this talking to everybody here, learning about, what everybody's doing for sickle cell disease, and I'm confident we can all work together to do more and have a larger impact.
Absolutely. Next up, going to be passing it to Osase for closing remarks and recommendations.
Thank you so much once again for this. This has been an amazing conversation. Thank you, Gina. Thank you, Tanika. Thank you, everybody. With the whole bill, I'm thinking about it for Canada too, and how it would be so much easier if we had something like that that helped when new medications came out, and with the funding and all that good stuff. So that's amazing. I would say that I think we should talk about practical steps patients can take to ensure optimal care is being received during admission in the hospital, or just being in the ER. Like little things like different medication routes that are available for medication administration. I know I was talking to a friend of mine, and she said she did not know that she could receive intravenous medication, like narcotics intravenously. And I was like, what do you mean by that? But it's true. Some people do not know this. They only think it's by PO, and some healthcare professionals will not tell you because then it's less work on their plate in terms of prescribing medications. So practical steps in the sense that there's subcutaneous, there's intramuscular medications, there's PO, which means you receive it by mouth, things like that. And also talking about the hierarchy in the healthcare system and the reporting system of it all. Because some patients go through things where they're treated unfairly, or being abused in the hospital, and just who do I go to? Who do I talk to? If my primary nurse is not listening to me, who do I go to next? Is it the charge nurse? Is it the nursing manager? Like, what's the hierarchy like, and how do I get the best out of this situation? And also, I would say that healthcare professionals learn to should normalize telling their patients about all their treatment options in a way that is suitable for that specific patient. I know that growing up when I was younger, all I heard was, oh, by the way, with sickle cell disease, you can't have children. It's just very difficult, and it's just hard, and you're gonna have to stop taking hydroxyurea, which is the medication that makes you feel normal. Like, to me, that's all it sounded like. There was no sense of hope. And I had to do my own research, and I saw people posting on places like TikTok where they're like, oh, I have sickle cell disease and have 2 kids. I have sickle cell disease and I was able to get married and my pregnancy went great. And I was like, oh, okay, well, this is not something I should be afraid of because it is a possibility. So in the sense of healthcare professionals, like figuring out ways to talk to their patients, telling them all their treatment options, and giving them that opportunity to make their own decision. Even when growing up, they did not bring up, when I was still in pediatrics, they didn't bring up the transplant at all. It was until my crisis became really, really bad that they even talked about the transplant and also talked about hydroxyurea. So things like that, it's like, let us know all our options and let us be part of the deciding team, whereby, okay, either I like this or I don't like this. It's sort of giving their patients back their autonomy. So that's my closing remark. Thank you once again, everyone.
Yes, absolutely. Thank you so much for taking the time to come out. We really appreciate having you at these events. I'm going to pass it to Sandra for closing remarks. I know you just came for the end of the discussion, but would love to hear your thoughts about the conversation and the room as a whole.
No, actually, Spencer, I've been here for quite some time. I'm sitting and checking you guys out. Thank you so much for having me. For what I would recommend and what I would encourage you to do as you're growing through your rooms is have an international night, because what the rules and laws are in the United States as far as patients and what they have access to and what they can seek is sometimes different in the international community. And so you want to include everybody, then it might just be helpful to have like an international night where, differences and similarities can be discussed. So that way all patients globally can actually understand what they have and what's actually available to them to use. Thank you so much, and I truly enjoyed this room.
Thanks for taking the time. Tanika, passing it to you for closing remarks and thoughts about the room.
All right, awesome. That's actually an awesome segue. My master's is in international development. I've done work internationally in helping to facilitate a conversation for the international. But for a topic for our U.S. Presidents, I would love to have either Cory Booker or Representative Charlie Crist to come on and speak about H.R. 7177, the Sickle Cell Expansion Act that has been put up into the legislature at a federal level, because we have to support our senators and representatives who are trying to fight for us. And that would be a good opportunity to use the weight of our organizations to bring them into a conversation like this. So I'm personally reaching out to Chris Van Halen here in Maryland concerning that bill, and I will be reaching out to Senator Booker as well. But I think that would be an excellent opportunity to hear their stance on this Sickle Cell Expansion Act. I believe they're asking for $500 million. So we should be able to help craft the story of where that $500 million is going to go if it's approved. And thank you. Sorry I was last. I had no idea, but I'll try to make the next session.
Absolutely. I think it's so important to bring our policymakers here and share with them the stories and the vision that we have. Tanika will definitely be reaching out about that process and also about the next room and just general collaboration efforts for the future. Lastly, going to pass it to Donna. Closing remarks, thoughts about the room.
I just want to again thank everybody for showing up tonight. I do think that we've come up with a lot of really good kind of ideas and energy. And Tanika, I will probably be in touch with you um, about your, initiative here, because I think that you're right. We just need to start bringing the conversation forward. And if they're going to put money towards sickle cell disease, the patients need to have the input. As far as kind of other ideas as we move forward in the room, I always think about what I call kind of the sticking points, like how do you know if you're successfully managing your condition? How do you know that you're getting the best care that you can? And what do you do when you run into problems? For me, the emergency room is always kind of one of the bigger topics, just because of the population that I deal with. So I think it could be really interesting to maybe bring in some ER docs, or physicians to kind of help people understand, how do you handle these situations, or what can you do if you feel like your pain is not being respected or you're not getting the care that you need. And also, I forget who said it. It might have been you, Shakira, when you said, if I don't know about it, I can't have access to it. I think that there's a lot more that needs to be done to educate people, and even just sharing the information here has been a great help. So again, thank you everyone for letting me be part of the conversation. And I'm done.
Well, just an absolutely wonderful room. Just want to share a really deep thanks to all our panelists and our audience for being here, for the thoughtful engagement. If anyone has any ideas that come up after this conversation, please reach out to me. My email's in my bio. I answer Clubhouse DMs. I'm on LinkedIn, whatever. Any way of communication that works for you probably works for me. So please reach out. We really want to do our best with these rooms and really make sure that they're hitting all the areas that they need to hit. In closing, again, I'm Spencer. I'm host for this room and ambassador at Consuli. A few closing announcements. In addition to this room, we also host a long COVID, data dignity, and clinical trials room. You can find us at consuli.net, or on socials. We post about the upcoming rooms. For direct questions, comment, feedback, find my email in my bio. Love to hear from everyone. Please be sure to follow all our moderators, panelists, and co-hosts, everyone in the audience. We're really looking to do our best to kind of lift this up and get this community going. Also, I mentioned it earlier, but if you think of anyone or have any connections to someone who might be interested in being on the panel or would provide a really unique point of view, perspective, we'd love to have them on the panel. So reach out, let me know. For those that joined late and missed opening announcements and don't yet know Consuli, broadly, Consuli is a public benefit company with the mission to enable individuals to participate in the data economy. We do this by operating a marketplace for members where we become their agent and assemble patients' health records, labs, prescription wearables, quality of life surveys, etc. Our members receive smart match individualized offers from us for opportunities, including to participate in clinical trials and data trials. If audience members want to participate in any of our clinical trials, specifically around sickle cell, you can go to consuli.net to be matched to a study, or you can click the link pinned at the top. It's not there right now. I'm going to pin it in 1 second. At the end of the room, there's a really important survey that can be passed around to people with sickle cell that will hopefully get them paired with a study and future data trials and clinical trials. So that's our 6th sickle cell room down. I believe the next one is going to be on July 28th, so fourth Thursday of July. Hope to see you all there. In the meantime, I'm going to leave some music on, let the room close itself out so people can peruse bios, find connections, and etc. Until then, look forward to having you guys at the next room. So everyone be well.